Hello, 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 YouTube world. It's Miss Patty with For Your CNA here for our live CNA practice test game show that we do twice a month. And we're going to present 15 test-like questions. I'll be going over that in a minute, and you'll be competing for real prizes. Welcome to everybody that's here. Happy November. Before we get started, I want to send a shout out to my mom. Today is her birthday. So happy birthday, Mom. Thank you so much for being the best part of my life. All right. So hi guys, when you come in, give me a hi in the chat. Let me know. Aw, thank you. That's so sweet. All right. So today's episode, just like last episode, is brought to you by CaresLink. So if you've not created your profile on CaresLink, head over there and do that after the show. It's CaresLink, and you'll have a lot of really useful information on there, but it provides a place for you to keep all of your certifications, all of your resume stuff, all in one place. And then if you find a job on there that you like, it's a one-click application and it's free. Go sign up. Continuing education will also be on there probably sometime at the beginning of next year. So go over and check it out. So careslink.com. Okay, today's questions. I got some feedback a little while ago that said that the questions were really a little too easy. Now, remember, I'm trying to keep these questions very similar to what you're going to find on the state exam, so it's a good preparation for you. And once you've learned the content, the questions really should be easy, right? They shouldn't be too challenging once you know the content. But in the spirit of fairness, today's questions are going to be just a little bit harder. The way that I worded the questions is a little bit different. You're going to have to think about it a little bit because they're a little trickier. And there are a few questions on the state exam that are presented this way that are a little bit trickier in the way that it's worded. So put your thinking caps on today because it's about to get just a little bit harder. And we'll see how we'll see how you guys do. All right. Yeah, Miles, I know. All right. So today is all about observation and reporting. And if you've listened to my classroom live stream, you know that this is 2/3 of our job, right? We go in and we do things. And that's kind of the part that we focus on is what we're doing. We're bathing, we're dressing, we're grooming, we're taking vital signs, we're making beds, we're helping with mobility. All of those things are what we do as CNAs. But we don't often think about the importance of observation and reporting and how that part of our job is even more important, because if we notice something and we don't report it to the nurse, that's a missed opportunity for an assessment that might actually change the way care is planned for that patient. So observation and reporting is something that we need to do, but we don't really focus on it too much. Now, on the test plan, there's a whole section on observation and reporting. So that's what we're going to focus on today for today's questions. All right, so you're going to compete for prizes. And the prizes that you're going to be competing for, first place is going to get a T-shirt. Now you get to choose one of these T-shirts. They're all on black T-shirts. We have CNA Care Crew. We have the class cheat shirt, which is what I'm wearing here. And you can see on the back, those are all of my sayings that you need to know how to do these skills. So it truly is a cheat shirt. And I've got them all on the back so you can't cheat on the test. So CNA Care Crew, we've got the class cheat shirt. We also have the Become Inspire Care. I love this shirt. And then the pink heart as well. So you can pick which one of those you would like. And for first place. Second place is going to get the card game. There it is. So the CNA Principles card game, and you can play this with anybody. It doesn't have to be medical people playing. They're going to play with numbers and colors. You're going to be playing with the principles that are involved. This is a great way to learn those principles that are on my shirt. So you're going to collect all of the principles in that particular or all the steps in that particular principle. But there's some specialty cards in here that are designed to make it a little bit more challenging. So you've got care plan crisis, you've got call off cards, you've got to avoid the crappy caregivers. Of course, we all want to avoid those. So there's a lot of strategy in it as well. And then third place is going to get, oops, let's go here. Third place is going to get our motivational gifts, which is our badge holder. And you have to win this. I don't give these out. You actually have to win this. It's a badge of honor. And then we have our motivational bracelets and keychains and such to thank you for being the best part of healthcare. All right, so how do you win these prizes? Well, I'm going to show you a question on the screen and read it to you along with the 4 choices. And then in the chat, you're going to put a number, 1, 2, 3, or 4. Don't put anything else, no letters, just number, 1, 2, 3, or 4. It's only going to register your first response. So if you change your mind, you're not going to get any points. So first response. So you put the number in the chat, hit send, it goes to YouTube, and then the program I use sits on top of YouTube and it reads the responses as they come in and keeps track of the points. First correct answer gets the most points. So you want to be quick about it, but don't be too quick this time because remember they're going to be a little bit more challenging. So make sure you're reading the question carefully before you hit that send button. So first correct answer gets the most points. All 15 questions will accumulate your points, and at the end, we'll give you a leaderboard that'll show you where you are, and the top 3 people are going to get the prizes. All right, so are you guys ready to get started today? Are you guys ready for today? All right, we're going to hit the countdown. So 30 seconds, guys. Go ahead and limber up those fingers. I see, Miles. All right, go ahead and limber up those fingers. You got about 15 seconds. And here we go. Here we go. First question. What observation should you monitor for when caring for a patient with congestive heart failure? 1, blue tinge around the mouth or fingers. 2, decreased food intake or appetite. 3, a weight loss of 3 pounds. 4, shortness of breath on exertion. So what observation should you monitor for when caring for a patient with congestive heart failure? 1, blue tinge around the mouth or fingers. 2, decreased food intake or appetite. 3, weight loss of 3 pounds. Or 4, shortness of breath on exertion. Got about 15 seconds left. Go ahead and lock in that final answer. This one's trickier than you think it is. Trickier than you think it is. All right. The right answer here is actually 1. Yeah, most of you guys put 4, and I'll tell you why that's not the right answer. So we want to be looking for a blue tinge around the mouth or the fingers. That lets us know that they're not oxygenating well, and that's got to be reported to the nurse immediately. They have a drop in blood oxygen. We're seeing it with those signs, so that has to be reported immediately. It's very common with congestive heart failure to have a decreased food intake or appetite, to have a weight loss, and to have shortness of breath on exertion. What you would want to monitor for is shortness of breath at rest. Shortness of breath on exertion is actually normal for congestive heart failure. I know, tricky one, right? So Miles came in first on that one, followed by Christine. Good job. Good job. All right, question 2. Which of the following needs to be reported to the nurse immediately? 1, continued swelling in a CHF patient. 2, a patient has a dry cough. 3, a diabetic patient with dizziness and weakness. or 4, a patient temperature of 99.1. So which of the following needs to be reported to the nurse immediately? 1, continued swelling in a CHF patient. 2, a patient has a dry cough. 3, a diabetic patient with dizziness and weakness. Or 4, a patient temperature of 99.1. Go ahead and lock in your final answer. You've got about 15 seconds left. I told you today is going to be a harder question day. I know, these are tough. I know, I had a hard time writing them. They're tough. The right answer here is number 3. Yeah, diabetic patient with dizziness and weakness. That has to be reported right away because this patient is at a fall risk, but they also most likely have a blood sugar anomaly, either too high or too low, and both of those need to be treated right away. Now, 1 isn't the right answer because it says continued swelling in a CHF patient. Remember, the question says which needs to be reported to the nurse immediately, meaning there's a change. That immediately is prompt, right? Yes, we do need to report that there's continued swelling, but the immediately makes that not the right answer. Dry cough, not immediate. The temperature for number 4 is actually normal. 97.6 to 99.6 is considered normal. So diabetic patient with dizziness is what we would want to report immediately. Rosemary came in first on that one, followed by Helen, Christine, and Ava. Number 3. Which of the following change of aging may increase the risk of burns? 1, thinner, drier skin. 2, delayed reflexes. 3, decreased sense of taste and smell. Or 4, lower baseline body temperature. Which of the following change of aging may increase the risk of burns? 1, thinner, drier skin. 2, delayed reflexes. 3, decreased sense of taste and smell. Or 4, lower baseline body temperature. Go ahead and lock in your final answer. Again, this one is tricky. I know, you guys are all going to send me hate mail after today. Remember, somebody asked for this. All right, and this is a very valid question on the state exam. The right answer here is actually number 2, delayed reflexes. As we age, our nervous system slows down. So if you go to reach for something hot, as a young person, if it's too hot, you're going to let go, and that decreases your risk for burns. Because the reflexes are slowed down, you might hold on to that hot object longer, which increases your risk of burns. Now, yes, these are all signs of aging, guys. Thinner, drier skin, we already know that, but it doesn't increase your risk of burns. Decreased sense of taste and smell, again, it's not talking about the temperature. And lower baseline body temperature has nothing to do with this. So these are all changes of aging, but it doesn't have anything to do with increasing the risk of burns. All right, so Ava nobody got this one right. Oh my goodness, nobody got this one right. Yes, I know, Ava, they're hard. All right, number 4. To report an observation, you should 1, inform the nurse in a private area. 2, hold all reports until the end of shift. 3, find the nurse immediately. Or 4, document the observation in the patient's chart. So to report an observation, guys, read this carefully, read it carefully. To report an observation, you should 1, inform the nurse in a private area. 2, hold all reports until the end of shift. 3, find the nurse immediately. Or 4, document the observation in the patient's chart. 10 seconds, lock in your final answer. I know these are hard, but this is a very, very possible question on the state exam. Number 1 is your right answer here. Inform the nurse in a private area. This has to do with confidentiality, right? We don't hold all reports until the end of shift. That's not what we do. We notify the nurse. Now, number 3 sounds right. And a lot of you picked number 3, find the nurse immediately. But it doesn't say to report an observation immediately, right? So you got to pay attention to those words. So it just says to report an observation. So number 3 could be right if it was an immediate situation, an urgent situation. Number 4, that is not how we notify nurses. Now, we may have to document it, but that's not how you notify the nurse. This question was about confidentiality. Yeah, nobody got this right. I'm so sorry, guys. I know. I'll make them easier next time. Number 5. You are concerned the nurse is not addressing a change in the patient. So you told the nurse something, you're concerned they're not addressing it. You should, 1, tell the nurse they need to do something. 2, document that the nurse was notified. 3, notify the director of nurses. Or 4, report the change to the nurse again. So you are concerned the nurse is not addressing a change in the patient. You should, 1, tell the nurse they need to do something. 2, document that the nurse was notified. 3, notify the director of nurses. Or 4, report the change to the nurse again. So what do you guys think? About 5 seconds left. A couple of you guys got this one right. Yeah, number 4 is correct here. Now, number 1 is not correct. We don't, as CNAs, tell the nurse they need to do something. That's not our role. Number 2, document that the nurse was notified. That's not taking care of the patient at all. That doesn't address this situation. And number 3 sounds right. And a lot of you guys put number 3. It sounds right. Notify the director of nurses. But that is actually not the right answer because that's not your chain of command. You would notify the nursing supervisor, then the ADON, and then the director of nurses, whatever your chain of command is, but we don't go directly to the top. So we would just remind the nurse, hey, I told you that this patient is having this. You're going to remind them and then go up your chain of command. So Michelle came in first, followed by Helen and Darlene. All right, number 6. What observation needs to be reported immediately when feeding a patient? So what observation needs to be reported immediately when feeding a patient? 1, refusing a drink before and during the meal. 2, coughing while swallowing. 3, food intake of 50%. Or 4, needs help cutting meat. What observation needs to be reported immediately when feeding a patient? This one was a little bit easier. 1, refusing a drink before and during the meal. 2, coughing while swallowing. 3, food intake of 50%. Or 4, needs help cutting meat. Go ahead and lock in your final answers. You got about 10 seconds left. So all of these would need to be reported, wouldn't they? But which one needs to be reported immediately? Yeah, coughing while swallowing. That's actually telling us that there's a swallowing difficulty. This patient's at risk of aspiration. Please do not feed them anymore. Go get a nurse right away because we do not want that food or fluid to end up in their lungs. So this is one of the very first signs of a swallowing difficulty, and it's one that gets missed a lot in long-term care. CNAs or resident aides don't report it to the nurse, so it gets missed. And then we lose out on an opportunity to be able to treat it early before it becomes a real serious problem. So if you notice a patient that's coughing while you're feeding them, that always needs to be reported immediately. All right. Michelle came in first, followed by Ava, Kelly, and Chrissy. Good job, guys. Good job. All right, question number 7. You're caring for a patient who begins having a seizure. You should slow down and read the answers. 1, stay with the patient. 2, get the nurse quickly. 3, put all side rails up. Or 4, document the seizure immediately. So you're caring for a patient who begins having a seizure. You should, 1, stay with the patient. 2, get the nurse quickly. 3, put all side rails up. Or 4, document the seizure immediately. So go ahead and lock in your final answer. You've got about 20 seconds left. Yeah, you guys are kind of split on this one. I'm going to tell you why the right answer is right in just a minute. Yep. So the right answer here is number 1. We're going to stay with the patient. Anytime there's an emergency, any emergency, I don't care what it is, if the patient falls, if they are having chest pain, if they're having signs of a stroke, if they're having a seizure, it doesn't matter what it is. If there's an emergency, you never leave somebody alone in an emergency. We want to stay with them. We want to send somebody else to go get the nurse, but we're not leaving them alone. And that's why number 2 is not right. So those of you that answered number 2, I need you to understand this because you will have one of these questions on the state exam. In an emergency, we do not leave the patient. We send somebody else to go get the nurse. Putting side rails up, that doesn't help. Okay, and we're not going to stop and document while they're having a seizure. All right, looks like Michelle came in first, followed by Chrissy B, Ava, and Kelly. Good job, guys. Good job. Number 8, halfway point. When caring for a patient with Parkinson's disease, you should observe 4. 1, obstacles and walking paths. 2, hand tremors. 3, difficulty dressing. Or 4, a mask-like expression. When caring for a patient with Parkinson's disease, you should observe 4. 1, obstacles and walking paths. 2, hand tremors. 3, difficulty dressing. Or 4, a mask-like expression. Go ahead and lock in your final answers. So what should the CNA be observing for? About 10 seconds left. Yeah, some of you guys are, you're giving me what are the symptoms of? Yeah, we need to be looking out for obstacles. The other 3 are just symptoms. We're going to see these things with Parkinson's patients. You're going to see hand tremors. You're going to see difficulty dressing. You're going to see the mask-like expression. Those are all normal in Parkinson's. We expect to see those. It's not what we're really observing for. We also know that they walk with a shuffling gait, which means they don't lift their feet. They're at risk of tripping. So our job is to look for any obstacles that might cause them to fall. Safety. This is a safety question, and a lot of you looked at it as a what are the signs of Parkinson's question. Be careful because the test is going to want you to apply the knowledge, not just regurgitate it. So Michelle came in first, followed by Helen, Chrissy, and Christine. I know that one was tough. Question 9. A patient is found on the floor. The CNA should, 1, document the fall immediately. 2, notify the nurse. 3, ask the patient if they have any injuries. Or 4, send another CNA to get the nurse. What do you guys think? A patient is found on the floor. The CNA should, 1, document the fall immediately. 2, notify the nurse. 3, ask the patient if they have any injuries. Or 4, send another CNA to get the nurse. I just gave you this answer 3 questions ago. I told you how to answer this 3 questions ago. So think back. What did I say? And that'll give you the right answer. All right. About 5 seconds left. What do you guys think? Yeah, we're going to send somebody else. This is an emergency. You never leave a patient in an emergency. So those of you who answered number 2, that is not correct. You can't leave the patient. We don't want to stop and document. That doesn't do anything for the patient. Now, number 3, a lot of you answered number 3, which was interesting to me. Ask the patient if they have any injuries. Why? Why? If you're asking the patient, do you have any injuries, that leads me to believe you're going to help that patient up if they say no. That patient may not be aware that they have injury because of the adrenaline reaction. Not your job here. We don't assess. We notify, and we have to stay with the patient, so that means we're going to send somebody else to notify the nurse. So Gypsy came in first, followed by Rosemarie and Mabandu. Mabandu? I hope I said that right. All right. Question number 10. The tasks a CNA is permitted to do will be determined by all of the following except 1. Your preceptor, 2. The state statutes, 3. Your employer's policies and procedures, and 4. The care plan. So the tasks that a CNA is permitted to do will be determined by all of the following except 1. Your preceptor, 2. State statutes, 3. Employer policies and procedures, and 4. The care plan. Now, I just went over this at the very beginning of yesterday's live stream. So if you don't know the answer to this, you need to go watch the first half hour of yesterday's Class 7 live stream. And I actually talked about this. So let's see. Your preceptor is actually the correct answer here because your scope of practice is going to be defined by your state statutes, number 1. And then your employer is going to determine which of those tasks they're willing to accept liability for you to perform. So your employer's policies and procedures will define what you're allowed to do in that setting. And then the care plan tells you which of those tasks are going to apply to this patient. So state statutes, policies and procedures, and care plan is ultimately what is going to define the task you're going to do for that particular patient. Your preceptor has nothing to do with this. Now, a lot of us think they do. Well, in this place, we do it this way. No, that's not going to hold up in a court of law, so be careful. Miles came in first, followed by Michelle, Shikaya, and Ava. Good job. Number 11. All observations must be 1. Documented in the patient's chart, 2. Verified by another staff member, 3. Explained to the family, or 4. Relayed to the nurse promptly. All observations must be 1. Documented in the patient's chart, 2. Verified by another staff member, 3. Explained to the family, or 4. Relayed to the nurse promptly. Go ahead and lock in your final answer. You got about 20 seconds left. Yeah, you got to think this one through, guys. Think this one through. Sometimes we look at an answer, it looks right, but there might be a better one a little further down the road. So go ahead and lock in your final answer. The right answer here is number 4. Yeah, relayed to the nurse promptly. That's our job. Observation and reporting. It's not observation and documentation. The whole name of the game show today is observation and reporting, which tells you what to do here. Documenting in the patient's chart is going to depend on your setting. There's a lot of settings that don't allow CNAs to document anything but numbers. So you have to be really careful here. Observations don't need to be verified by another staff member. If you notice something, say something. And we don't explain to the family about anything, not our role. The nurse's job is education and relaying of information to families, not the CNAs. But we are responsible to relay the information that we notice to the nurse. So Miles came in first, followed by Chrissy, Helen, and Gypsy. Always read all answers before you choose the right one. Number 12. A resident has refused an assigned task multiple times. The CNA should, 1, ask if there's a reason for the refusal. Number 2, document that the patient is non-compliant. 3, perform the task anyway since the patient is confused. Or 4, refuse to care for the resident anymore. A resident has refused an assigned task multiple times. The CNA should, 1, ask if there's a reason for the refusal. 2, document that the patient is non-compliant. 3, perform the task anyway since the patient is confused. Or 4, refuse to care for the resident anymore. Go ahead and lock in your final answer. What do you guys think? Yeah, this one was a little bit easier. Yeah, we're going to ask if there's a reason for the refusal. Sometimes it's, as simple as, well, I don't want to take a shower because everybody that showers me, the water's too hot and it's uncomfortable. Or I don't want you to do foot care because my feet hurt and I don't like it when people touch them. Or I don't want to get dressed because my clothes aren't fitting well anymore. It's uncomfortable. All of those things have to be relayed on to the nurse, right? Those are all observations, and they indicate that there's a problem that we need to be solving. So if we just, oh, well, he's not going to let me shower him, and we just go about our day and we don't let the nurse know there's something that's missed there, an opportunity that's missed. So Chrissy came in first, followed by Ava, Miles, and Michelle. All right, question number 13. Which of the following needs to be reported when measuring daily weights? 1, a weight loss of 2 pounds or less. 2, a change in appetite for a meal. 3, a weight gain of 3 pounds or more. Or 4, persistent meal intake of 75%. So which of the following needs to be reported when measuring daily weights? 1, a weight loss of 2 pounds or less. 2, a change in appetite for a meal. 3, a weight gain of 3 pounds or more. Or 4, a persistent meal intake of 75%. Read all the answers before you choose one. All right, this is asking if you know what the threshold is for reporting with daily weights. And the right answer here is a weight gain of 3 pounds or more. That's industry standard. If we are doing daily weights on somebody, if there's a weight gain of 3 pounds or more, it must be reported because it's generally fluid retention. A weight loss of 2 pounds or less, your weight fluctuates all day, every day, depending on what you eat, your bowel movement status, your activity, what time of day it is. So a weight variation of 2 pounds or less is not statistically relevant. A change in appetite for a meal, one meal, yeah, we don't care. Your appetite changes all the time. And a persistent meal intake of 75% is actually pretty good. That means you're eating most of all of the food that's provided to you. But a weight gain of 3 pounds or more indicates possible fluid retention and must be looked at. Make sure you know that because you may have a question on it on the state exam. All right, question number 14. You are caring for a patient on blood thinners. The CNA should report 1, discoloration under the skin. 2, changes in appetite. 3, inability to sleep. Or 4, mild forgetfulness. So you're caring for a patient on blood thinners. The CNA should report 1, discoloration under the skin. 2, changes in appetite. 3, inability to sleep. Or 4, mild forgetfulness. Go ahead and lock in your final answers. You've got about 20 seconds. One question to go after this, guys. I know you've hung in there. Good job. I know these are a little bit harder, but you will have a few of these harder type questions on the state exam. And it's not the content that's harder, guys. It's the way the question is worded that's probably tripping you up. The right answer here is discoloration under the skin. What that's showing is internal bleeding somewhere. Now, we see this all the time with bruises, right? When you get a bruise, that is discoloration under the skin. And that tells us blood is no longer in the capillary system. It has leaked out into the tissues. But you can also see this around the back and the sides. And that is something called retroperitoneal bleeding. If your patient has that, it is an emergency. Any discoloration under the skin must be reported because there is a leaky problem somewhere that has to be looked at. Changes in appetite, sleep, or forgetfulness doesn't have anything to do with blood thinners. So Ava, Michelle, Chrissy, and Miles came in top 4. Last question. Here we go. A CNA is assigned to a resident who is usually alert and oriented, but is now confused and disoriented. What is the CNA's best action? 1, reorient the resident and wait for improvement. 2, document and continue care as normal. 3, ask the resident's roommate what happened. Or 4, report the change to the nurse immediately. So a CNA is assigned to a resident who is usually alert and oriented, but is now confused and disoriented. What is the CNA's best action? 1, reorient the resident and wait for improvement. 2, document and continue care as normal. 3, ask the resident's roommate what happened. Or 4, report the change to the nurse immediately. The right answer here is number 4, report the change to the nurse immediately. Absolutely. So if we have any sudden change, anything that's different, that's not normal for a patient, we have to report that like right now. We're not going to reorient and wait, because if that patient is having interruption of blood flow to the brain, you waiting can cost them their life. So we don't wait. Anything that happens suddenly requires sudden action on our part. Okay? Good job. All right, so let's see how we did on this question. Top 3 on this question was Michelle, Ava, and Shakaya. So let's see how we did overall. Who won? Let's see. Top place is Michelle for first. Second place is Miles. And third place is Helen. So, Michelle, you're going to get a T-shirt, and you can choose from any of the 4. I'll show them to you again. Miles, you'll get a card game. And Ava is going to get the, all right, Miles, yeah, I know. You've been begging since the beginning. You'll have to come back in 2 weeks. All right, guys, so let's see here. Let me show you your prizes. So, first place, Michelle, you can get the Pink Heart shirt, or the CNA Care Crew shirt, or the this shirt, which is our cheat shirt, or Become Inspire Care. So, those of you that won, I need you to send me some information. So you are going to go to this email, or you're going to send an email to this email, foryourcna@gmail.com, and you are going to give me your screen name, your real name, your mailing address, and what place you came in. So first place, you're also going to tell me which T-shirt you want, and what size T-shirt as well. So for everybody that won, screen name, real name, mailing address, and what place you came in. And then Michelle, you're also going to give me your T-shirt size and style. Okay? All right. I know, Miles. I know. Yeah. I'm so sorry. But we'll do this again in 2 weeks. So right before Thanksgiving, we'll have another CNA practice test game show. We do this on the first and third Tuesday of every month at 11 a.m. And I hope to see you on the next one as well. So, yeah, I'm sorry, Miles. So make sure that you join. Put it on your calendars. If you go to our website, courses.foryourcna.com, there's going to be a pop-up, and you can actually put in, we'll send you a text message before we go live for the next game show, and that way you can just click the link and join. That might be an easier way to remind yourself that we're doing this, and I hope to see you on the next one as well. So tune in tomorrow. Tomorrow we're doing graduation for my current class, and I'm going to be going over some employability things that could be of interest to you, even if you're already certified. It'll help you find a new job opportunity as well as ace that interview. So we've got some really good information coming up tomorrow. And then I am taking a break from teaching until January 5th. I'll still be doing the game shows, but no teaching, no classes until January 5th because I'm developing the lessons for the home health aid program that's going to be going onto our CARES link. Site that I told you they're sponsoring. So I'm creating the home health aid content for that as well. So pay attention to my YouTube channel. I'll be posting some new home health aid videos on there so you can go through them if you want to. I'd love it for you to support me by giving me a thumbs up on the new videos. That way they get advanced in the YouTube algorithm a little bit quicker. And that's a great way to support us so that we can continue to come in here and have fun with you. So thanks for joining me today. I really, really appreciate it. And I will see you on the next one. Until next time, happy caregiving. Bye.